Parkinson's disease. You've definitely heard the name, right? But what does it actually mean? What's really going on inside the brain of someone who's living with it? Well, in this explainer, we're going to dive deep and break it all down. The science, the signs, and what it's really like. So at its very core, Parkinson's is what's called a progressive neurodegenerative disorder. Now, that word progressive is super important here. It means the condition doesn't just happen all at once, it develops slowly, gradually over time as crucial brain cells are lost. And its main target, a person's ability to control their own movement. And that really leads us to the biggest question of all, doesn't it? What is actually happening on a biological level when that incredibly complex system in our brain for controlling movement just starts to fail? Okay, so first, let's look at the big picture. We need to get a really solid handle on what Parkinson's is and what it isn't. Here's the bottom line. Parkinson's is all about the loss of very specific cells in the brain, neurons that produce a chemical called dopamine. When these neurons start to die off, the brain doesn't have enough dopamine. And that loss is what directly causes the classic symptoms we all associate with the disease. The tremors, the stiffness, the slowness, and problems with balance. And, this is not some rare condition. Far from it. In fact, Parkinson's is the second most common neurodegenerative disorder in the entire world. The only thing ahead of it is Alzheimer's. And it's becoming more common as our global population gets older. All right, now let's zoom in. To really get what's going on, we have to go deep inside the brain and see how this communication breakdown is happening, right down at the cellular level. So everything, and I mean everything, revolves around dopamine. The best way to think about it is like a messenger. Its whole job is to carry signals that tell your body to make smooth, coordinated, controlled movements. Without enough of this messenger, the messages just don't get through properly. Okay, this image right here shows you the problem perfectly. We're looking at a part of the brain called the Substantia nigra. You can just think of it as the brain's main dopamine factory. In Parkinson's, the little factory workers, the cells, start to die off. And as they disappear, the supply of dopamine just plummets. That's when the brain's ability to control movement really starts to fall apart. And check this out. This is the smoking gun. When scientists look at these damaged brain cells under a powerful microscope, they find these little weird clumps of protein. They're called Lewy bodies. This is the physical evidence of the damage, the true hallmark of Parkinson's disease. So we've got the science down, but how does all that damage inside the brain actually show up in a person? Well, let's get into the 4 key motor symptoms. And there's a super easy way to remember them with the acronym TRAP. This little mnemonic, TRAP, is a great tool. Even doctors use it to remember the main features of the disease. So let's break down exactly what each of those letters stands for. First up, T is for tremor. This is usually what's called a resting tremor. That means it's most obvious when a person's hand or limb is just resting, and it often starts on just one side of the body. Next, R is for rigidity. This is a kind of deep stiffness or inflexibility in the arms, legs, or even the torso. Then we've got A for akinesia or bradykinesia, fancy words that just mean slowness of movement. This can make it really hard to even start a simple motion, and for many, it's the most disabling symptom of all. And finally, P is for postural instability. This is all about problems with balance and coordination, which usually shows up later in the disease and unfortunately can lead to falls. But here's the thing. The story absolutely does not end with movement. It is so important to understand that Parkinson's comes with a whole range of hidden symptoms that can be just as tough, if not tougher, to deal with. This comparison here is crucial. On the left, you've got the TRAP symptoms we just talked about. But look at the right column. This is the hidden side of the disease. Things like depression, really difficult sleep problems, and even issues with automatic body functions, like blood pressure. And what's wild is that some of these non-motor symptoms, like losing your sense of smell, can actually show up years before a tremor ever starts. They can be some of the earliest warning signs. So, with such a complex condition, how do doctors even diagnose it? And more importantly, how is it managed? Let's talk about that and how people are able to live full lives with the disease thanks to some really proactive treatments. Now, this might actually surprise you, but there isn't a single blood test or brain scan that can say, yep, that's Parkinson's. The diagnosis is clinical. It means a good neurologist basically acts like a detective. They piece together clues from a person's symptoms, a detailed neurological exam, and this is a big one, how well the person responds when they're given Parkinson's medication. And we have to be really clear about this. Right now, there is no cure for Parkinson's disease. But, and this is a really, really big but, the treatments available are all about managing the symptoms, and they can be incredibly effective at improving a person's quality of life for a long, long time. And managing Parkinson's isn't just about popping a pill. It's a whole person approach. It's a combination of medication, of course, but also supportive care like physical and occupational therapy to keep the body strong and functioning. And in some advanced cases, there are even surgical options like deep brain stimulation. Now, when it comes to medication, there is one drug that is the absolute gold standard, and that's Levodopa. See, you can't just give someone a dopamine pill. The brain has a protective barrier that won't let it in. But Levodopa is clever. It's a precursor that can get past that barrier. Once it's inside the brain, it gets converted into the dopamine that's been missing. For so many people, this drug provides a massive, dramatic improvement in their motor symptoms. So, we've seen what Parkinson's is, how it works in the brain, and how it can be managed. Treatments are getting better all the time, improving life for millions. But that brings us to the final and most important question, the one that drives researchers every single day. How do we take that next giant leap and figure out how to stop this disease before it even gets a chance to start?